basically an education series for the key committees in the House and the Senate, and spent that summer before the legislative session, and I would do the Medicaid 101 show, basically, which was, I think, the first time the legislature had ever seen a PowerPoint. And it was really pretty fancy. I had a great staff person who really knew how to do it, and she could grow grass, and they would grow on the screen, and they were multicolored, and lines would move, and it was bells and whistles, and frankly, everybody came, all the members came, and they sat and they listened, and it was a fairly unique experience, I think. But we put together a major reform package, which was going to basically restructure the financing system of the indigent county system and take money that was in there, match it through Medicaid, and get broader coverage through the Medicaid system because it would bring down so much more federal money. And that became Senate Bill 10 in the 1995 legislative session. In August before that session, I was Medicaid director, and also Governor Richards had asked me to be her representative on Hillary Clinton's task force. So we were having a legislative session where Medicaid was the issue. I was a Medicaid director, and yet I was serving multiple days at a time in Washington on the First Lady's task force for health care. And that experience was amazing because there were 6 governors who the First Lady had asked to have someone on the committee. This committee was called the Secret Committee. I don't know if y'all have ever studied this or not, but it was the Secret Committee. And that was a very controversial thing. The membership was really unknown, except that every time you turned around, it was bigger and bigger. And it started as 200, and it became 300 and 400. I think it ended up somewhere in the 500 realm. And with multiple working committees that would work on particular areas, and then every other Friday night they would have something called the toll gate process, where each committee would come in, and the First Lady and Tipper Gore and other key people would sit up at a panel and listen to these presentations and then give guidance to them as to which direction to go as they continued to develop this massive health reform plan. Our job was to be the sounding board, usually before they went before the toll gates, for any and all of these committees that had to do with the administration of health policy. And so we would listen to them, and they would say, "This is what we're planning to do. We're going to have the Big Bang Theory. We're going to have everybody have a health security card, and that card will be ready on July 4th, 1996." And my job was to say, "What? You want what? You're going to do what?" Now, the people from Minnesota and Vermont and Colorado and, some of those states were like, "Yeah, man, we can do that. Let's go." But we couldn't. And my job was to try to help protect that. And then I would come back home and brief Governor Richards as to what was going on. And so towards the end of that spring of 1993, she went up and explained to them why this was not going to work, why it was politically infeasible, why she could not support the package. And my participation kind of filtered out after that experience. And of course, we all know what happened, which was exactly what she predicted would happen. She named me Commissioner of Health and Human Services in 1994 in August, and I was very prepped and very excited. I had finally gotten to the job where I could have the ability to make big change and really help people in Texas. And as you know, in 1994, Ann was not reelected, and we had Governor Bush elected to serve starting in 1995. So once again, actually what happened was the morning after, at about 6:15 in the morning, and I had been up late, not celebrating, and with others, and my phone rang at 6:15 in the morning, and I answered the phone, and I said, "Hello," and I hear this voice. It goes, "DeAnn, don't do anything stupid." And I was like, "Excuse me?" I didn't know who this was. I said, "Excuse me," and it was Governor Bullock, and he said, "Don't do anything stupid. I know you like Ann Richards, but I'm telling, this is a good fella, and I'm telling him to keep you." So I was put in a position of having to decide whether or not I could be the commissioner or continue in Medicaid even. And we had this massive reform package that I had worked for a year and a half on, with enormous numbers of people and staff, and with I thought a good way to help transform a lot of indigent care in the state. So I ended up, I had a meeting with Governor Bush. It lasted 1 hour and 17 minutes. The day after he was inaugurated, and we had a debate that went like this about the role of government in healthcare. And suffice it to say, we did not have the same idea about that. And so I was asked to stay on for Medicaid for the reform package, which I did do. And we did get that package passed. The legislature was all revved up for it, but it was never implemented. And I left government later that year to go into some consulting. So all of those kinds of experiences, put me in a position of, first of all, having to change jobs a lot, but secondly, a broad kind of understanding of the way things work in the policy-making process, and how to implement, how to write legislation, the role of the lobby, the budget implications of things. And in 2002, old friends of mine from the Senate Budget Committee, now this is a place I worked for 8 months, but I became very close friends with 2 people from that committee. And they, at this point in time in their career, were running this program out of the U.S. Treasury called the Office of Technical Assistance. And they called me the morning after that 2002 election when it was clear that the future of CHIP and Medicaid was not going to be bright, at least for a while. And they called me and said, hey, you want to go to South Africa and work with the South African government? And I said, what? And they said, we've had people there since 1995, and the budget's all set up, and the process works pretty well, and they're kind of finished, but they're looking for us to give them somebody who knows how to restructure and, rework social grant systems and, the way that they're administered and the way they're financed. And so these friends, were like, go see. And I thought, okay, you're going to give me a free trip to South Africa to talk to some people and maybe do this. And they said, yeah, because we think when you get there, you'll want to do it. And so I went and met with all of them and came back home and told them no, that I would not be going to South Africa because of the crime, because of the lifestyle that you were forced to lead in South Africa, in spite of all the wonderful things going on in the country. And so for a couple of months, I just kept saying no, and then I had a change of heart. We were in the middle of a legislative session, and I thought, I just can't do this anymore. And so I had a change of heart and decided to go. And moved over there very quickly after that and spent 3 years working in the National Treasury, where we went about the process of reviewing the system as they had it. They had, basically when apartheid ended and Mandela came in with the new government in South Africa, they took everything that was and left it in place in terms of grant systems and programs, which I would describe to you as a highly European type model, very much out of the Dutch, British, kind of background. And they had left it in place, but just took off all the racial restrictions and said it's not just for Anglos anymore, it's for anybody who qualifies based on poverty. And so they have an old age grant, they have a disability system, they have a mom and kids program type thing, they have a healthcare system of some type, and not like Medicaid, but they have clinics and systems, and they don't have food stamps. It's kind of the only thing that's not the same as here. And the restrictions and the low levels of coverage and things are very similar to here, but in South Africa, because people are so poor, because there's so many people who are unemployed, 1 in 4 South Africans directly receive a grant, and they believe 1 to 2 more actually rely on that grant in families. And so it's a huge issue. It was a huge, huge part of the budget. The reason that one of the reasons the government was trying to reform it was because the Human Rights Commission kept suing the government, class action lawsuits. For anybody who's worked and lived in Texas, this should sound very familiar to you. And they were getting class action lawsuits in the court, the Supreme